What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, or a test for any other virus, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for a surprise Saturday edition of the Virus Update for Saturday, December 7th, 2024. That's right, we're doing a surprise edition today because since our update yesterday, so many things have came out in news. I have found things that we missed yesterday. Yes, it is a very busy period, so why wait till Sunday? Let's do an update today. If you're new to my channel, this is where I do news and updates on all those viruses that can make us sick, or news on people who are sick, famous people. There's a lot of different things that we talk about here. Want to stay informed and stay safe? Just subscribe down below. It's the best way to do that. If you enjoy what you see today, please consider giving this a thumbs up. It does help me in the algorithm. If you have any comments, leave them down below. The more interactions we get on these videos, the more YouTube is going to push this throughout the algorithm, because it tells YouTube, hey, people like this content. Of course, share this video with anyone you know. If you know someone who maybe is not taking things seriously, send them my way, because I'll tell you what, right now, a lot of people are starting to get sick once again. It's getting colder out. Viruses are spreading more, and of course, hit that notification bell to be notified of my latest video. Alrighty, we have a ton of things to get through once again today. Starting off with this, which is very important, and it could lead to future complications. Let me explain. The USDA orders testing of milk for bird flu. Now, this is the USDA doing this now under the current president. There's going to be a new president next year. There's going to be new leaders. Don't know what's going to happen when we get to that point, but right now they are doing it for 6 states, and it is going to start, I believe, on December 16th, and the first 6 states will be California, Colorado, Michigan, Mississippi, Oregon, and Pennsylvania. And basically what they're testing for is bird flu, H5N1. They want to see if it shows up. And here's where this could get complicated. If they start to find it in milk, well, obviously there's going to have to be recalls on milk. This could lead to, down the line, maybe a milk shortage. I mean, hopefully they're not going to find much in the way of bird flu in milk, but if they do start finding this, well, then we start to run into more problems. Milk shortage just being one of the problems. More people potentially getting sick. There's a whole lot of questions here with no answers at the moment, but what we do know is they are now going to start testing milk in 6 states. Once again, California, Colorado, Michigan, Mississippi, Oregon, and right here in my own state, Pennsylvania. They're going to test it for bird flu. The national milk supply must be tested, they said. This is a mandate. I mean, this is not optional. It says the national milk supply must be tested for bird flu under a federal order that was announced yesterday by the U.S. Department of Agriculture. And the handling of raw milk, such as bulk milk transporters or dairy processors, must collect and share samples with the USDA upon request. So this is pretty serious. And of course, I'll be following this. I'll have any updates. I'll tweet on Twitter, and over on Blue Sky, I'll post there as well. Alright, just going to read a headline here. Long COVID-19 is costing Americans money. Does this surprise anyone? Real quick, there are people that have had to lose their jobs because, hey, they're constantly sick, and the employer's saying, you know what, we can't keep doing this. We can't keep having you out sick. Or there's people that are quitting their jobs, and then they cannot financially support themselves. Then they have to lose their house. There's a lot of different situations. And plus, those who do not have good health care need to see specialists because of long COVID. That costs money. Trust me, I know. I've seen a few specialists. Each time I go to a specialist, it's $150. I think it is going down to $140 next year. You get the point. I've been paying $150 every time I go to a specialist. It adds up, and it adds up even more for those people who have lost their jobs and are now going on disability. Yeah, long COVID. There's nothing good about it. We need to treat long COVID. All right, moving on now to this. And remember, we were talking about yesterday. If you didn't see yesterday, over in Congo, there is this virus. It's a mystery virus. Here's the latest update. There have been 12 new cases, 394 total, 3 new deaths, 74 total. Test results expected later today, and hopefully we do get some more news on just what the heck is going on there. Remember, it is hitting young people hard at this time. In the United States, Central Oregon sees a rise in positivity for flu test results, but health officials say the worst is yet to come, and yeah, that would make sense because we just only had Thanksgiving just a little over a week ago, and we got more holidays to come. Kwanzaa, Three Kings, Hanukkah, Christmas, New Year's, yes, many more holidays, and all those holiday gatherings and parties in between. So yeah, I would agree with that. The worst probably is yet to come. Alright, Slum 41 cancels Australian tour due to an illness. They have a member in the band dealing with the illness. I'm not seeing what it is, but at this time the doctors are saying it's time that you sideline yourself. So if one person's sidelined, they're all sidelined. Slum 41. I believe, what are they? Punk rock? What do you even call them? I remember them from when I was a kid. They're a rock band, to say the least. Probably punk rock would be a good way to describe them. Moving on to this, again, just reading a headline that says, did we really need hospital masking during COVID-19? And I hate that word during because we're still in COVID-19. COVID never ended, so during should not have even been used. Come on, medical press. Get better with your warning. Study says yes. Well, of course. I mean, a big issue right now in many places, and we don't fully have the data here in the United States at this day and age, but hospital-acquired infections are a big deal. Example, in my state of Pennsylvania, there was some data suggesting that we had 3,000 hospitalizations within just a few week period. I think it was 3,000. It was a really high number. It shocked me. I really wonder how many of those cases are hospital acquired infection, and not just for COVID, a whole bunch of different viruses. I mean, viruses can spread. If someone shows up to the hospital with COVID and no one's masking, well, guess what? There's going to be other people that get it. So do we really need masking? Yes, we do need masking in the hospitals. We needed it then, and we needed it now because guess what? COVID hasn't ended. Flu hasn't ended. If we've learned anything from the COVID pandemic, we have learned that, hey, masking is not only good for COVID. I mean, if it can stop COVID, which is a really transmissible virus, think of what it can do for the viruses that are less transmissible. It can stop the spread of them. And if you wear the correct mask, it will really do well. If you wear those flimsy surgical, or God forbid you still wear a cloth mask, yeah, that's not going to do much. Those ones complain, oh, masks don't work, because you're wearing the wrong type of mask. Get a high quality mask, and I'm telling you, it will work in most cases. Alrighty. Moving on, we have more in the way of news. Italy has reported 2,440 new infections and 46 deaths were reported in the last week from November 28th to December 4th, 2024. Now, there are some slight rises here. Reported cases, they're up 15%. Again, that's 2,440. Deaths, though, are down by 2%, 46, and the positivity rate is 4.3%. That was up by 0.7%. Hospitalized was down by 5%, 1,292. ICU number was at 54. That was down by 7. Alrighty, moving on. A single mutation could make bird flu much worse, study finds. Yeah, bird flu is something that is changing constantly. I mean, here we are. We opened up today with this video talking about how they are going to be testing milk for bird flu. I mean, yes, it is constantly changing. We have that child up in Canada, which, by the way, we have not got any update on in over a week. I haven't seen anything new over a week, and that child, last I saw, was in critical condition, and this virus is constantly getting smarter. We're seeing it in more and more animals. I believe we saw it in pigs not long ago, so that's telling me that, hey, H5N1, the virus is mutating, and we're all getting smarter, and the smarter it gets, the better chance it could mutate and better infect people, and that's something we do actually need to be concerned about. It's something that is a problem. Just a quick reminder, my website is datareport.info. It will forever be free. Anyone can join in and post over on my site. You can start a topic. You can reply to a topic. You can do whatever you like. It is a free and safe environment. I moderate it. Of course, it's my site, and I do have another moderator named Steve. Does a wonderful job. And yes, it is a safe place for you to go post about these viruses. We even have archives. Are you trying to find about a study? Maybe you have a doctor's appointment because you had a problem post-COVID. You want to look up a study? I'm constantly posting studies that I find and archiving the links to them so you can go and check them out and find out just what the heck it's all about. I mean, COVID on the lungs, the heart, the brain, diabetes, long COVID, loss of taste and smell, kids, variants, masking studies that show masking works, COVID transmission, COVID in wildlife. Yes, white-tailed deer have been known to have COVID. It's been a thing. All right, moving on. Taking a look at today's air qualities. If this doesn't come up, that's fine. Because you just know, if you're in the West Coast, it's really bad air quality right now because of the fireplace season. It is that time of year. Yeah, take a look at this. That, and maybe there is some wildfire activity. I haven't heard anything, but fireplaces are being used at this time, which does translate to bad air quality out there. And across the Great Lakes as well. Pennsylvania is seeing some moderate air quality today. Want to learn more about the weather and climate? Well, I do have another place where I do that. It is Climate Data Report. Not certain I'm going to post a video there today. Might give that channel a day off. And if I don't post one today, there will definitely be a weather update there tomorrow. That is Climate Data Report right here on YouTube. In Philadelphia yesterday, 796 EMS incidents were reported. So, it's below 800, but again, we're starting to trend higher than what we have been seeing, simply because, well, things were very low, and, that couldn't have stayed that way. Taking a look at Montgomery County, Pennsylvania, a couple respiratory emergency calls right now, stroke call at the moment, currently 9 calls, and it has been busier. Well, it was busier in Chester County earlier, not as busy now, but I do note this, not one, but 2 strokes, one in East Coventry Township, Pennsylvania, and Honeybrook, Pennsylvania. Not a good thing. And heart problems in Kennett Township, Pennsylvania. Let's take a look and see how hospitals are doing overall in the state of Pennsylvania. And we do see green, we see gray, always a lot of gray, which means hospitals not reporting, but there is some yellow showing up in Carlisle, Pennsylvania. Looks like there's a behavior health diversion at this time. In Chambersburg, Pennsylvania, and this is going back to the 5th. I don't know why it's doing that. Why they're showing data from multiple days ago. In Malvern, Pennsylvania, Bryn Mawr Hospital is showing, this was on the 6th. Yesterday they were dealing with overcrowding. That's not good. Hopefully that has rectified, but they haven't updated it. Neither has this one at Lankenau Medical Center. That's out in Ardmore, Pennsylvania, or just near there. And we can see up in, a lot of these are not updating, so we're not going to continue on with this. Take a look at Canada. The viral activity level for COVID is moderate. Flu A is low. Flu B is not detected at this time. RSV is coming in at high levels in Canada, and even some parts of the United States. There have been some wastewater sites I've been finding that are coming up high now. National positivity rate for COVID at Walgreens is 13.3%. That was up 0.7%. I would be very surprised if on Monday's update it does not come in higher once again. Let's take a look at wastewater scan if we can. We'll take a look at a few wastewater sites here, and we're just going to go first off nationwide level. And on the nationwide level, COVID, it's not really rising yet. You can see RSV is starting to rise faster. That listing of low, probably not going to be around much longer. Probably switch to medium. COVID is also in medium, by the way. Influenza A is low at this time. Influenza B is also listed as low. HMPV is low. Norovirus at this time continues to rise. There was a wonky movement downward. Wouldn't surprise me if it starts going back up once again. All right, let's take a look at some wastewater sites. I'm seeing, what is this? Yankton, South Dakota? I don't ever recall there being a South Dakota wastewater site. Maybe I've never noticed it. Let's check this out. It's only 20,000 population. COVID there, wow. Back in November, this particular site just randomly went off and did their own thing. And this happens sometimes. So they had a big rise. Now it's dropping. And we'll see what happens if that continues to drop. RSV is low. Influenza A is listed as low, but that looks like it went from 0 to near 120 pathogens. Yeah, that's rising. And then the wonky movement downward, but that rose pretty quickly. That's something to keep an eye on. It's probably an area where there are a lot of farms, I would assume. Influenza B is low. HMPV is low. Norovirus, what the? 400,000 pathogens. That is ridiculously high. I can't say I've ever seen norovirus that high at a wastewater facility. If you live in this area in South Dakota, and I hope I said that correctly. Is that how you pronounce it? Yankton, South Dakota? I really hope I'm saying that correctly. I'll check myself later on. If you live there, please make sure you're wiping down all services. 400,000 pathogens is just totally insane. And take a look at everything else, not much of an issue at this time. Let's look somewhere else in the southeast this time. Remember, we're not doing Wastewater Sunday anymore, so we are going to do a few wastewater sites here. We'll go to the southeast, we'll go to the northeast, and then we'll go to the west coast. COVID in the Miami area, we're taking a look at here, is listed in the medium category, although on the chart it is, we'll say that is medium category. RSV is listed at high, influenza A is low, influenza B is low, HMPV is low, and norovirus at this time is in the high category. Hepatitis, there were some detections back in October. It looked like, October, and no Mpox detections at this time. Now let's go up to the northeast, and I suggest we should take a look at Newark, New Jersey. It's a huge wastewater site. It's got high population, 1.5 million population. COVID, not really rising all that much just yet. RSV at this time is listed at high. Influenza A is medium. Influenza B is low. HMPV, low but rising. Norovirus is high and rising at this time. And take a look at that. Back in October, Mpox detection. And hepatitis A is low at this time. I also do, real quickly, want to take a look at Southwest Connecticut. And there's a reason why we're focusing on this area for just a moment. Because New York State is starting to rise. New York City is starting to rise. And plus, we don't get much of anything out of Connecticut. So it's not a bad idea to give Connecticut a shout out in wastewater. And we can see here, medium for COVID. It was rising a little bit now. Looks like maybe it's dropping a little bit. RSV is listed at low, dropping a little bit. Influenza A, they do have it categorized at high at this time. And overall, yes, it has been rising since the end of November. Influenza B is low. HMPV is low. Norovirus is rising at this time. And everything else is not much of an issue right now. Let's go out to the West Coast and see what is going on in Las Vegas. And in Las Vegas, we see COVID is medium at this time. RSV is listed at low. Influenza A, yet again, another wastewater site where influenza A is high, influenza B is low, HMPV is low, norovirus is high at this time, and everything else is not much of an issue. Although, look at all these hepatitis A detections. Quite a few of them already. Moving on. Taking a look at emergency department visits for people diagnosed with COVID. These are people showing up at the emergency department diagnosed with COVID. Nationally, it is starting to rise, and I think we will take a look at all states. We haven't done this in quite some time, so we need to do it. So once again, nationally it's starting to rise. Alabama is starting to rise. Alaska still dropping. Arizona was rising. Not good to see that. Arkansas is starting to rise. California, infant stages of rising. I would say still flat at this time. It may rise soon. Colorado is starting to rise. Connecticut still dropping. Delaware, small rise. Washington, D.C., small rise. Florida, very small rise. Same with Georgia, Guam. Guam is still very low at this time. Hawaii is still dropping somewhat. Idaho was rising, then they leveled off. Illinois is starting to rise. Indiana, Iowa, Kansas, Kentucky, Louisiana, all starting to rise. Maine is still dropping. Maryland, looks like maybe it might be starting to rise. Massachusetts starting to rise a little bit. Michigan is rising a little bit. Mississippi, still low. Montana, yes, at the very end it may be starting to rise. Nebraska, definitely starting to rise. Nevada, maybe rising soon. New Hampshire starting to rise. New Jersey slowly starting to rise. New Mexico has been rising. New York State, very infant stages of rising. North Carolina still flat, not rising yet. North Dakota dropping a little bit. That's good news. Ohio is starting to rise, and we saw Ohio's cases did go up this week. They had over 3,000 of them. Oregon is still dropping. Pennsylvania is starting to rise. No surprise there. We had the hospitalization report from Pennsylvania, which is not good. Rhode Island at this time, bouncing off the bottom, maybe starting to rise. South Carolina starting to rise. South Dakota slowly starting to rise. Tennessee perhaps starting to rise. Texas, ever so slight, if anything, more so flat still. Utah was rising, then it leveled off. We'll see what happens next week if that goes up from there. Vermont, definitely starting to rise. Virginia, starting to rise. Washington, flat still. Remember, Washington State got hit really hard in the summer. West Virginia starting to rise slightly. Wisconsin starting to rise slightly. Nothing from Wyoming, and we also did not mention Missouri, because Missouri is never listed here for some reason. Come on, Missouri, report your data. Collect your data. Are you even collecting your data? I honestly just do not know. Alright, taking a look at the influenza-like illness map, and we can see Washington, D.C. is now listed in the very high category. That's not good. Louisiana is high. Also high this week is Arizona and Georgia. And then we see moderate in California, moderate in Alabama and Tennessee, also moderate in Mississippi, Nevada, and Texas is coming up moderate at this time, as is New York City, and there are now a lot of states that are in the low category that before were in the minimal category, so we are starting to see things pick up the pace here, and if I animated this, you can see here, we go back a few weeks, and look what happened post-Thanksgiving, and this map is only going to fill in more. I wouldn't be surprised if New York City goes high next week. I wouldn't be surprised if Louisiana goes very high. You get the point. Things are trending in the wrong direction. Taking a look at New Jersey hospital status. Look at this. Pretty much everything is pretty much okay. We just have one hospital in Mullica Hill. Looks like not even just a full ER divert. It's just no big deal at this time. I mean, really, look at this. Just one hospital with a problem in New Jersey. That is some good news to report. Let's hope it stays that way. Taking a look at Colorado. Colorado, for hospitalizations, they have 108 admissions in the past week. Influenza was 31. RSV was 17. The emergency department visits diagnosed with COVID there was 0.91%, almost a percent. It was up slightly. 0.6% for influenza, 0.07% for RSV. That's really low. Positivity rate for cases for COVID is 7.72%. That was up by almost a percent. And influenza, 4.6%. That was up by 1.45%. And RSV actually dropped slightly to 2.01%. California this week reported a 2.2% positivity rate for COVID. That was flat. Flu did go up. 7.5% positivity rate, up by 2.3%. RSV, 6%, up by 1.8%. Alrighty, finally today, going over to the notes for Saturday's virus update. And first off, before we get to some data from CJS 83172, you may notice I'm not following my own rule, which was 2 virus updates a week, 3 if really necessary. Well, like a light switch, over the last couple weeks, things have gotten much busier. And the way I do these updates is, I use multiple browser windows. I use Google Chrome, I use Microsoft Edge. And on Microsoft Edge, that's where I keep the virus update window. As I find news stories that say, hey, I need to include this in the next update, well, I put them over there. If I find data, well, or someone tweeted something, well, I put that over there. And you know what happens? That starts to fill up the news stories. And I think going forward, if I have enough time in a day and it is filled up, guess what? We're doing an as-needed update. So we're not going to do one tomorrow. We were supposed to do this update tomorrow, but there's so many things there that I wanted to do it today and then clear it, and then we'll have another update on Monday or Tuesday. So get where I'm coming from. We're going to have as-needed updates. The schedule it was supposed to be where we do Monday, Wednesday, and Saturday. But right now, we're doing as-needed updates. Some weeks, hey, it may just be 2 updates. Other weeks, it may be more than 3. And like this week, for example, as you see, this is now what, the 4th update this week? So we're doing as needed updates. All right, now some data from CJS A3172. And first off, Thursday daily weekly reporting states: Florida, 248 new cases and 11 deaths. New Jersey, 491 new cases and 1 new death. New York, 863 new cases. Puerto Rico, 122 new cases and 2 new deaths. Now Thursday's weekly reporting states: Alaska, 137 new cases over 2 weeks, and 1 new death reported by the CDC. Connecticut, which had a case dump. Wow, this is a pretty big case dump for Connecticut. 1,432 new cases and 7 CDC reported deaths. Delaware, 181 new cases and 7 new deaths over the past 2 weeks. Georgia, 674 new cases and 8 new deaths. Kentucky, 652 new positive tests and 3 CDC reported deaths. Massachusetts, 889 new cases and 3 new deaths. Minnesota, 1,404 new cases and 13 new deaths. North Carolina, 375 hospital visits and 12 CDC reported deaths. Ohio, as I already mentioned yesterday, but we'll repeat it again for those who are new and just found my channel, 3,081 cases were reported in Ohio this week, plus 18 new deaths. Yes, your cases are starting to go up. Deaths did not go up there this week. Oklahoma, 12 CDC reported deaths. Utah, 389 people added to the Living with COVID tab and 4 new deaths. Colorado, 258 new positive tests, a 7.7 test positivity rate, as I mentioned earlier, and 9 CDC reported deaths. New Mexico this week, 995 new cases and 2 CDC reported deaths. Friday, daily-weekday reporting states: Florida had another 366 new cases on Friday and 8 new deaths. For today, they had 1,918 cases and 47 deaths reported over the past 7 days. It doesn't look like their deaths are going up yet. At least I don't think they are. Nationally, deaths probably won't rise for several more weeks. New Jersey, 320 new cases and 2 new deaths reported yesterday. That should probably say 2,004 cases and 6 deaths reported this week. New York, 788 new cases reported yesterday, and 3,798 cases and 18 new deaths reported over the past 7 days. Their cases are slowly starting to rise. Puerto Rico, 125 new cases yesterday and 648 cases and 2 deaths reported this past week. Now for the Friday weekly reporting states: Alabama, 9 new deaths reported by the CDC data tracker. California, 68 new deaths reported over the past 2 weeks. Idaho, 432 new emergency department visits and 1 new death reported by the CDC data tracker. Illinois, 268 new CDC reported hospitalizations and 15 deaths reported to the CDC data tracker. Louisiana, 1,904 new reported emergency department visits. That seems like an increase to me. And 5 new CDC reported deaths. Missouri, 173 new CDC reported hospitalizations and 15 new deaths. Mississippi, 10 new deaths reported to the CDC data tracker. New Hampshire, 6 new state reported deaths over the past 2 weeks. Pennsylvania, what are we going to do about my state? This is just horrible, and this number will likely go up again at some point. 638 new reported hospitalizations and 36 deaths reported to the CDC data tracker. And Texas reports 1,037 new cases and 11 state-reported deaths. Wisconsin, 577 new positive tests, a 5.2% test case positivity rate, and 8 new deaths reported. West Virginia, last but not least, 569 new positive tests and 3 new deaths reported to the CDC data tracker. Thank you so much, CJS83172, for providing us with that data. You do such a fantastic job with presenting us with this data. Alrighty, folks, that was a lot. Yet again, we're right at a 30-minute video. See why we couldn't wait till Sunday? It would have been crazy. Probably would have been over 35 minutes. So that does it for the Saturday edition, the surprise edition of the virus update. If you enjoyed this update, give it a thumbs up. If you're new here, subscribe down below, hit that notification bell, share this video with anyone you know, and of course, leave any comments down below. We'll have another update again, either Monday or Tuesday, as needed. Until I see you again, stay safe, have a fantastic weekend, everyone, and thanks so much for watching. Bye-bye, take care.